Good morning, everyone, and welcome. I'm Dr. S.K. Singh, and I'm delighted to be here with you today. Today's presentation is titled Types of Human Error in Pharma Manufacturing and Control. We're going to explore the different kinds of human errors that can occur in the pharmaceutical industry and discuss ways to identify and minimize them. Over the next few slides, I'll walk you through the key concepts and insights on this important topic. Let's get started. Let's take a closer look at what we mean by human error. Essentially, it's any unintentional deviation from approved procedures or standards. It's important to understand that these errors can happen in many ways, whether it's in documentation, processing, testing, or even decision-making. You'll find that human errors can occur at various stages of the manufacturing process, including during the manufacturing itself, in quality control, or in quality assurance activities. This is a critical area because human error is considered a significant risk factor in pharmaceutical manufacturing. It can directly impact the quality of the product, which in turn affects patient safety and regulatory compliance. Because the pharmaceutical industry is highly regulated, especially under Good Manufacturing Practices, or GMP, managing human error is essential to stay within compliance. Errors can happen not only in the production of active pharmaceutical ingredients, or APIs, but also during herbal processing and within quality control laboratories. Understanding these points helps us to see why controlling human error is a key part of ensuring product quality and safety across the entire manufacturing process. Let's take a closer look at the classification of human error. First, we have skill-based errors, which include slips and lapses. These are often unintentional mistakes that happen when we're focused on other tasks or under stress. For example, pressing the wrong button or forgetting a step. Next, there are rule-based errors, where someone applies a rule incorrectly or misinterprets a set of guidelines. This might occur if a procedure is misunderstood or not followed properly. Then, we have knowledge-based errors, which happen when someone faces a situation outside their experience or expertise and has to problem-solve on the spot. These can lead to errors because the individual doesn't have the necessary information or understanding. Lastly, there are violations, which are deliberate deviations from standard procedures or rules. These are intentional acts, often driven by time pressures, complacency, or perceived shortcuts. Recognizing these different types of errors is crucial because it helps us develop targeted strategies to prevent them and improve safety overall. Let's talk about skill-based errors, which are often called slips and lapses. These happen during routine GMP operations, so when tasks are familiar but mistakes still occur. For example, in API manufacturing, you might see an incorrect weighing of raw materials caused by distraction, or missing a filtration step during synthesis. These are small errors that happen when we're not fully focused. In herbal manufacturing, similar errors can occur, like mixing the wrong plant batch during grinding or forgetting to monitor the drying time. These mistakes are typically due to familiarity with the process, but can be easily overlooked. Now, what causes these types of errors? Fatigue from long shifts is a common factor. When we're tired, our attention wanes and mistakes slip through. Repetitive tasks like batch processing can also lead to autopilot mode, increasing the chance of slips. Poor labeling or containers that look alike can cause us to pick the wrong ingredients or materials, and interruptions during critical steps, like someone entering the room or a phone call, can break our focus at just the wrong moment. Understanding these causes helps us develop strategies to minimize these errors and maintain high quality and safety in our operations. Let's talk about rule-based errors. These happen when we apply the wrong standard operating procedure, or SOP, or when we misinterpret the procedures we need to follow. For example, in API manufacturing, using an incorrect solvent ratio during a reaction can lead to issues. Similarly, following an outdated cleaning validation procedure might compromise quality. Now, in herbal processes, applying the wrong extraction method, like choosing between aqueous and solvent extraction, can cause problems. Also, setting incorrect temperature limits during drying can affect the final product. What causes these errors? Often, it's due to poor clarity in the SOPs themselves. If the instructions aren't clear, it's easy to get confused. Lack of proper training on the latest procedures can also lead us astray. Inadequate document control means outdated or incorrect procedures might still be in use. And sometimes, similar processes can cause confusion, especially if they're not clearly distinguished. Understanding these causes helps us prevent rule-based errors, which are critical to maintaining quality and compliance across both pharmaceutical and herbal processes. Let's talk about knowledge-based errors. These typically happen in non-routine or new processes, where there's less familiarization or experience. For example, in active pharmaceutical ingredients, or APIs, one common mistake is adjusting reaction parameters incorrectly, which can lead to impurities forming. Another example is misinterpreting analytical results, like from HPLC or GC, which can cause incorrect conclusions about the product's quality. In herbal medicine, knowledge-based errors can occur if the wrong plant species is identified, or if the standardization of active constituents isn't done properly. These errors highlight the importance of thorough knowledge and accurate interpretation when working with complex or new processes. Recognizing these potential pitfalls helps us improve quality and safety across both pharmaceutical and herbal products, reinforcing the overall theme of understanding and vigilance in our work. Now let's talk about violations, specifically intentional errors. These are deliberate deviations from good manufacturing practices, or GMP. Such violations might include skipping line clearance, which is critical to prevent cross-contamination, or not recording data properly in batch manufacturing records, which compromises traceability. Sometimes, operators bypass equipment alarms, ignoring warnings that could prevent issues. These violations can be categorized into 3 types. First, routine violations, which are habitual shortcuts taken over time, sometimes out of convenience or complacency. Then, situational violations occur due to pressure, perhaps when deadlines are tight and safety seems to take a backseat. Lastly, there are exceptional violations, typically during emergency conditions when immediate action is necessary. But even then, we must be cautious. Understanding these different types helps us recognize the importance of maintaining integrity and vigilance in our processes. It's essential to be aware that such intentional errors can have serious implications for product quality and patient safety, which ties directly into our overall commitment to GMP compliance. Now, let's talk about human error in documentation. This can include data entry mistakes, which are often simple typos or incorrect inputs that can lead to significant issues down the line. It also involves incomplete batch records, where not all the necessary information is captured, making it difficult to trace or verify processes later. Another common problem is backdating or overwriting entries, which can compromise the integrity of the records and obscure the true timeline of events. For example, missing critical process parameter recordings can be a serious oversight, potentially affecting product quality and compliance. Moving on to human error in quality control, errors can happen during sample preparation, like incorrect handling or labeling, which can skew results. Calculation errors in assays are also common, leading to inaccurate measurements of product potency or purity. Improper instrument calibration is another risk, which can cause measurements to be off. To illustrate, if someone uses the wrong dilution factor, it might produce a false potency result, giving a misleading picture of the product's quality. All of these issues highlight how human errors, if not carefully managed, can significantly impact the reliability of our documentation and quality assurance processes. Let's talk about error control and prevention. One of the first lines of defense is strict adherence to good manufacturing practices, or GMP. This ensures that every step meets quality standards and reduces errors. SOP standardization and version control are also crucial. Having clear, up-to-date procedures helps prevent mistakes caused by confusion or outdated instructions. Automation plays a big role too, with systems like weighing and SCADA to minimize human involvement and errors. Additionally, using barcoding and electronic batch records makes tracking and verification much more reliable, cutting down on manual errors. Training and qualification programs are essential. They prepare staff thoroughly and keep everyone updated on best practices. Poka-yoke, or error-proofing techniques, are designed to prevent mistakes before they happen, adding an extra layer of safety. Now, why is all this so important? Because human error in pharma can lead to serious consequences. It can cause batch rejections or recalls, which are costly and damaging to trust. Regulatory noncompliance, like GMP violations, can result in fines or sanctions. Most importantly, errors can jeopardize patient safety, risking lives. And on a broader scale, these mistakes can lead to financial losses and harm the reputation of the company. So, integrating these error control measures is not just about compliance. It's about safeguarding patients, maintaining trust, and ensuring the integrity of the entire manufacturing process. So, to wrap things up, I want to emphasize that human error is something we can't completely eliminate, but it is definitely something we can manage effectively. The key is to focus on improving our systems, providing proper training, and implementing strong controls to reduce the chances of mistakes. Having a solid quality assurance culture is essential. It helps ensure that we stay compliant with regulations and maintain high product quality. This approach is critical not only in the API industry, but also in the herbal pharmaceutical sector, where product integrity and safety are paramount. Overall, by strengthening these areas, we can create a more reliable and consistent process that benefits both our companies and our customers. For further support, please don't hesitate to reach out. If you have any questions or need additional information, we're here to help. Just contact us through the provided channels. Thank you so much for your time and attention today. We appreciate your engagement and look forward to assisting you further.